Good afternoon.
Good afternoon.
I'm Dr. Catherine Siengo Mutisia. I'm a consultant psychiatrist for the last 20 years with a passion for both prevention, promotion of mental health, and treatment. I work at Madari National Teaching and Referral Hospital and at Nairobi Mental Services. Thank you.
Good afternoon. Yeah, my name is Dr. Anne Mongela. I'm a consultant psychiatrist and founder of Mind Clarity Center, which is a mental health and wellness center where we believe in impacting lives one at a time. And speaking of impacting, I have a couple of my students that I also teach at Kenyatta National Hospital and also head the HIV prevention unit at Kenyatta, where we are also integrating mental health into HIV care.
Good afternoon, everyone. My name is Dr. Taria Makuti. I work with AR Healthcare. So I wear many hats. I am in management, but my passion is actually occupational health and wellness. So that's why I'm here today. Karibuni.
Thank you so much. We also have
good afternoon. So my name is Martha Kilonzo, a counseling psychologist, and Martha is practicing with the Martha Mesocordial Hospital, whereby we have different programs. One of them being the counseling department. We also have the psychiatry, among others. So karibuni sana, our tent is just behind you. Thank you.
Help me appreciate my panelists today. Thank you so much. You have wealth of knowledge when it comes to topic of mental health, and most of us are very ignorant. Some of us are suffering, we don't know. We should be diagnosed and we have not taken the necessary measures. So my first question, I want to start with Martin. How does someone tell the difference between stress and diagnosable condition?
Thank you for the question. So obviously, when your body is in a state of balance, your mood is balanced, your energy levels are balanced, and the normal behavior is of course balanced. Now, when it comes to a stressful situation, it puts you in what of course is regarded as either fight or flight. So your body is in a situation whereby wherever is stressing you, you have to fight that. And so what happens is you get increase in your, say, blood pressure, the cortisol levels increase, so that then you have the production of energy so that you're able to respond. And the issue is that is what used to happen in our forefathers. Because maybe you're hunting and all that, and that happens, and so that you're able to respond. But the problem is now with the current lifestyle and the state of health is you're constantly in that state, and it affects you in different aspects. So there are different aspects of attributes that we look at that will be able to indicate whether someone is stressed or not. And also from, if I can speak about it from a nutritional point of view, sometimes we realize it's taxing a lot from nutrients point of view. If you're having certain deficiencies, will cause that kind of a problem. So there are many aspects to the question.
Thank you so much, Martin. Let's appreciate that response. Dr. Taria, this is for you. What's the most common mental health condition people ignore or mislabel?
The psychiatrists are staring at me because they're waiting to see what will happen. But realistically, in Kenya, what we have, especially when patients come to see us, say as general practitioners or as wellness doctors, many tend to say that they are depressed. So everyone comes and says they have some degree of depression, even though these may be other mental health illnesses or conditions that are being confused with depression. So we tend to focus on depression, even on social media. Everyone will say, oh, I'm depressed, there's depression, I'm feeling depressed, but that may not always be the case. So there could also be some misdiagnosis. But I'd ask from the panelists, because you're in hospitals and you have the data currently, what are you misdiagnosing?
Let's hear from Dr.
say we are misdiagnosing, but anxiety, substance use disorders are also very underdiagnosed.
Okay.
That's what I would say.
Is it because of we don't have enough knowledge? Is it because we are leaning towards what sounds familiar, and just because we share the same symptoms, I'm like, this is also my thing.
Exactly, exactly. You know, like you'd say, nakuanga tu na stress. You know, like stress. Sometimes stress can it can go beyond stress. You know, because stress is a normal reaction. You know, but when it gets out of hand, it can lead to a mental illness. You can get anxiety disorder, you can get depression. So sometimes anxiety disorders may be confused with stress.
Yeah.
You know? Yeah. Or even substance use disorders. People are drinking alcohol, you know. It's what we do, it's sherehe, but it gets out of hand. And we are not aware of that until it's too late.
All right. There's something that Dr. Taria has just mentioned, and she said that the psychiatrist might be able to think differently. Do we have many chances whereby what is diagnosed from a psychiatrist's point of view, when it comes to the doctor, you feel like this is not accurate, and what's usually off?
Actually, no. To clarify that, I would say, you see the way Dr. Ann is saying sometimes someone has a substance use disorder.
Yes.
They could have a substance use disorder, but they could have another disorder as well. So they have what we call comorbids. And what you find, sometimes we are so focused on one thing when someone is suffering from multiple things. Or when we do send them to a specialist who's a psychiatrist, now they come up with, or they determine that they had maybe another underlying disorder that was leading to all these things. So sometimes we ignore one thing or we focus too much on another when there was another underlying cause that could have been sorted out and subject to all these other issues altogether.
Okay. So in your field, you have to work together, doctors, psychiatrists. You have to have a good synergy, and no one is wrong. It's just that there's emphasis on one end, how the client is leaning towards, or the patient is leaning towards what they think is a problem, and you are able to spot that there is something else that apart from what you're saying.
I would say mental health is on a spectrum.
Yeah.
You're not only seen by doctors.
Yes.
So you're not only seen by a general practitioner. You'll not only see a psychiatrist. There are counselors you may see psychologists. So there are many people you see along the way when they are coming up with a diagnosis. But there are certain rules that are followed. I leave the psychiatrist to do that. That's their specialty.
Yes.
So I don't just wake up and look at someone and they tell me, I'm not feeling so good, and I say, oh wow, you're depressed. No, there's certain criteria you have to attain, feel, which is what they do look for.
Okay, so Dr. Captain, I think you can help us in this conversation. And I want to take another route. This is not from a medical point of view. This is from family, friends, people who are there for, the patients or people who are going through these things. And how can we offer support to someone who has a mental health condition without overstepping?
Pretty much. At times, you have people with mental illness and they don't realize they are sick. In the severe cases like schizophrenia or bipolar, they might not realize that what they're experiencing is not real, or the voices they're hearing are not real. So the person living with this sick person needs to help them get help. And we know that as a next of kin, you can actually have somebody be treated even when they do not understand that they are sick. And back to the question of what can easily be missed out, in children, we have ADHD, or in people who are diagnosed to have substance use disorders. So we are looking at the diagnosis of alcohol use disorder. But when we dig deep, we find that this person also had lack of attention or hyperactivity, and in school they were labeled as the truant or the bad child.
Thank you so much. Let's appreciate those responses that we have so far. I want to just respond to this. Why do many people delay in terms of getting a diagnosis or treatment? What are the major causes why we delay?
Thank you for that question. So again, when we find a larger number or a large population is not conversant or they tend to delay as far as assessing or even visiting the facilities to be diagnosed, it's because of lack of awareness. You find that mental health awareness is just having you. So majority of the people out there, they don't really understand what is this mental health and what are the signs and symptoms associated with it. So you find there's lack of awareness. At the same time, there is lack of, I would say finances, so that one is not also able to attend to different facilities to be attended to. There's also the issue to do with lack of professionals, and mostly in this case, it's not in the urban center. In the rural areas, you find the population out there is yet to integrate what mental health is and what is happening. So you find with all these limitations, one is not able to rightly diagnose. And I think one of us said the most prevalent one is the depression and also the anxiety. So you find even in the normal stressors of life, one is going to be saying they are depressed. But in real sense, that person is not depressed, because again, you're looking at the signs and symptoms. What has really reason someone to be at that point? So the major thing is the lack of awareness in our society.
Lack of awareness. Dr. Aman?
Just to add on that, I think stigma is also it's a pertinent issue amongst us as Africans. So we associate mental health with spirituality, we are being bewitched and all that, or that shame, that self-stigma. If you're thinking, I'm going to be labeled, itaitwa mwendawazima and all that. So you keep to yourself, and that actually makes the condition worsen. So the earlier, the better, and the better the outcome. So stigma is key. Yeah.
I think any medical condition or any mental health condition that's well managed should allow the person with the condition to be able to carry out their everyday activities as normally as possible. And that just means that if you say require medication, because sometimes you don't exactly need medication.
Yes.
So through whatever means that have been used to treat you, whether it's therapy, whether it's medication, whether it's through other behavioral channels, your diet and all that, it should be able to allow you to live your life as normally as possible. So that if I work, I'm able to work. If I'm a student, I'm able to go to school. If I'm a parent, I'm able to parent my kids. If I am a child or whoever I am, I'm not feeling like I am just suffering those symptoms of that condition. That's what I would say is a well-managed mental health condition.
Okay, wow. From a psychiatrist, Dr. Khan.
Yes, to add on to that, good mental health is a state of well-being where you are able to reach your potential, adjust to stressors, because life will always have stressors, and be able to contribute to the community. And it's not just the absence of illnesses. So sometimes we confuse mental health problems and mental illnesses.
Mental health problems and mental illnesses. Appreciate my panelists, appreciate them. I want to spend more time with the audience so you can get to escape our ground, because if I get some questions from the ground. As I do that, the water we have next to you, see your deco, you can open, you can sip. It's not part of the props. All right, do you have any questions for us? Thank you. I'll come back to you.
Hello. So my question is directed to a psychiatrist. My name is Ajuri Lulu, and my question is, how do you deal with an instance where someone has a mental illness? They refuse to accept that they have it, and it's been over 10 years, their life has just stagnated, they're not able to engage in any income generating activities, and they don't eat balanced diet, or they refuse to eat. So how do you get this person to accept themselves and live with the condition and be able to at least do something to keep themselves in their patterns being good? Because at this rate now, it's become like their lifestyle and their new norm. And this is someone who's been clinically diagnosed with schizophrenia. Thank you.
Thank you so much. One last question.
Hello everyone, my name is Emma Gitoka. I'm a mental health champion. My question goes to Dr. Taria and also the panel in general. You've talked about that not all mental health, how the symptoms and all that, not everything that has to be given medicine and all that. But we see in Kenya, actually from experience having a conversation with someone who was firstly diagnosed with anxiety disorder, then schizophrenia, and then at that time schizoaffective disorder. So this person was really concerned, like, why was the doctor so quick to medicalize and not to take their time? Because the issue was that the doctor took only an hour in every instance, at most an hour to diagnose that. And also, in terms of medicalization and SHA, currently SHA, when you go, someone pays out of pocket for the mental health services and the mental health, the medicine. So is it by design that we've medicalized the industry and the mental health space? And how can stakeholders, everyone, work around and making it accessible to everyone and affordable?
Thank you so much for that question. That will be for Dr. Tamia. Thank you so much. I think, Martin, you can start us off.
Thank you for the question. The first thing is making sure that the gut health is maintained. The reason for that, you talked about the mood lifters, and one of the hormones that we do that is serotonin. And scientists tell us that about almost more than 80% of serotonin is produced in the gut. So that is to say, you have to make sure that your digestive health is in top shape. So foods we always talk about making sure that you get enough dietary fiber, you get enough of vitamins and minerals, just to make sure that the gut is in top shape. I heard about probiotics, because in your gut you've got both the good and the bad bacteria. So sometimes when that balance is altered, maybe because for some reason or the other you've been on antibiotics, so sometimes it's recommended that you do take antibiotics to make sure that the balance is maintained. Apart from that, from a diet point of view, some of the foods like chocolate, for instance, and that's when you take chocolate, you feel good, because it's one of those foods that will help to promote the production of serotonin. It's also made from some amino acids, so again your body requires that. So apart from that, you're looking at the foods that the nutrients that promote health of your brain and nervous system. So that will include the B vitamins. When we talk about the mood lifters or the neurotransmitters, they're made through a process that is known as methylation. That will require B vitamins, especially vitamin B6, will require vitamin B12, and folic acid. Also, apart from that, you need omegas, that is omega-3, that we get it from oily fish. For the ones who are vegan, you get it from seeds like chia seeds, flax seeds. Apart from that, of course, you require nutrients like magnesium, and we mentioned about that. And so it's a combination of different nutrients. So the idea is to make sure that your diet is balanced. You make sure as much as possible you've got a multicolored food. So all the foods that you see, they've got nice colors. They represent different nutrients, especially antioxidants. During the periods of stress and depression, your body is fighting a lot of oxidative stress, and these foods help to provide such nutrients to improve immunization.
Thank you so much. I want to ask a question. You can clap for it. I believe most of us are Kenyans here, and we have almost the same kind of food every day. Ugali being a common denominator. It's ugali and what? Ugali and what? And chapati and what? And rice and what? Can you give us just a simple meal without the vitamin B, vitamin C, plus what is accessible to these Kenyans we are seeing here? What they could eat on a daily basis? Just a few meals that would just work for us.
Thank you for that. So first we start with whole foods. So you make sure that whatever you're taking is not processed. So if you're doing ugali, do the whole meal ugali. If you're doing chapati, do the whole meal chapati. If you're doing rice, make sure it's brown rice, because if you do that, then there's nutrients in that aspect. Vegetables, the serving sizes, we recommend to take about 5 to 6 servings of vegetables a day. That means serving size would be, if it's not cooked for medium size cup, would be like 1 cup. That's a 1 serving. And the problem is sometimes we're not able to take that. For the fruits also, we're supposed to take, say, between around 5 fruits a day. That's a complete serving size. So if you're taking, say, a banana, you take a pineapple, you take an orange, that gives you the array of nutrients that you need. Also, you make sure that you include protein in your diet, as simple as eggs. Eggs are probably some of the very nutritious foods, especially from the aspect of the amino acid profile. In other ones, the quality of protein that you get, they are very rich in that. So you make sure that you've got protein source. If you can afford eggs, if you can afford, say, white meat, that is what is encouraged, fish. So then you've got your protein source, you've got your vegetables, and then you've got your carbohydrate source. So make sure that you get 3. You get your breakfast, you get your lunch, and then you get your dinner, and you're able to get quality snacks in between. So if you can use a fruit, for instance, or snack, if you can afford the nuts, they are very rich in things like omega-3 and nutrients. So from peanuts, almonds, like orange, the seeds as well. So that would make the diet.
So thank you. At least we now know what to eat. So you mean if we are eating white rice, you're just overworking the digestive system with no results?
Yeah, and actually these are some of, we talk about empty calories. So like for instance, if you're taking soda, all you get is calories. And if you don't need those calories, it's converted into fat. And then now you continue getting more weight. When they are processing food, the part they're taking out is the fiber that we're saying you should take. It's the nutrients, vitamins, and minerals that we're saying you should take.
Okay, thank you so much. Let's appreciate Martin. Dr. Taria, there was a question that was specifically for you.
Okay, there's the lady who asked the question. I don't know.
She's on
There's
the back.
another lady. Let me answer that question first. Because she asked about SHA, one of the points that came up was SHA not covering mental health conditions, yes. And then the fact that you probably have to pay out of pocket most of the time when you're going for treatment, say for any mental health condition generally. What I would say, I wouldn't say it's by design that someone sat there and did that. It's more of a system shortcoming where this starts from the get-go, from stigma. Because when we are thinking of treatment of mental health conditions or treatment of illnesses in general, we don't sit and think of mental health conditions first. I think I'm saying the truth, yeah? We'll probably think of other things, non-communicable diseases, diabetes, and heart conditions first. And then we think about how we can put aside money to treat that. And then we forget that for you to be healthy in general, you need to be well, or you need to have a state of wellness of not just physical well-being. So I like that when it was said, for you to be well, it doesn't mean that you are just lacking disease. Yeah, that's what we have to have a stop of mind. But when we are thinking about it as a system issue, as she asked, it means we have to solve many things. It means first, we even have to have, before we think about SHA or how you're going to pay to see a specialist, the specialist has to be available for you to see. You can't pay for someone who's not there in the first place. So that's why I say there are so many things that we have to consider in order to be able to deliver ideal mental health services to everyone. So there's the human resources, then there are the facilities, we need them, there's health education we have to be able to give you so that you're able to identify something is wrong or able to share this information with others and in the process reduce stigma. We are also not, there was the statement that said we are very quick to medicate, yeah? I'm hoping that that's not the perception of the public, that we are not very quick to medicate. It should be medication as needed. Why? We treat you based on evidence. So it's evidence-based treatment. And when you're diagnosed, it is for the specialist who see you to say, okay, this person has this condition to this level, they can do with counseling, or they can do with lifestyle changes, or they can do with group therapy, or they can do with more specialist treatment and a combination of this, or they require medication to this level. So it is not that we are quick to medicate, and we hope that that's not the perception that the public is taking. No, there are very many ways in which we give holistic treatment for mental health conditions, and that's why there's nutrition included here as well. That's why there's the counseling aspect included. It should not just be, you see the doctor and they put you on 10 meds. That's not the reality. And if it does happen, I think that's something that someone can raise. The badness is our health system is still growing. She lastly mentioned about a patient being diagnosed with anxiety, and then they were later diagnosed with depression, and then, no, schizophrenia, and then they were later diagnosed with schizoaffective disorder. So those are some of the conditions that can be confused or misdiagnosed based on how the patient presents or who they present to. So depending on the severity of the mental health condition, that's why we refer you based on what it is, so that the intervention or the diagnosis given ideally should be given by the psychiatrist so that you get the correct treatment once, not trial and error. I hope I've answered that question.
Yes, thank you so much, Daktari. And if you want to further this conversation before they leave, you can approach them and you can get even more answers. Dr. Anne?
Just before I answer the question on stigma, also about the patients that had multiple diagnoses, I would say that mental disorders can evolve. Today you have, let's say, schizophrenia, then tomorrow the doctor will say it's schizoaffective disorder. Because what your presentations and the criteria we're using to make the diagnosis, you're not in the same mental state every day. So sometimes these diagnoses evolve.
Yes.
Yeah.
Oh, wow. Yeah. Thank you for that addition.
Yeah, so on stigma, what we are doing right now, we are talking about mental wellness. I think having this kind of talks and discussions is what is getting us ahead. I believe 2 years ago, we were not in the same place we are as a country when it comes to mental wellness and just dealing with mental health issues. So stigma we have so many types of stigma. Let's start with self-stigma, public stigma. So for self-stigma, it's good to be aware of yourself and, get to understand what is good for you, because mental illness is a disease like any other. Most of the time we have instability or derangement in the brain chemicals, which the brain is a great organ, just like the liver, just like the pancreas when someone is diagnosed with diabetes. So let's take mental illness just like any other medical condition, and that will help us get out of our notion that mental illness is bewitchment, it's all spiritual and all that. It's that diseases like any other. And then also, if we can also, everybody can be their own, mental health advocates. If you are aware of mental illnesses and the effects and all that, you can be your brother's keeper. I think that is how we are going to get ahead when it comes to stigma, and more talks, more dialogue. Yeah.
Oh, thank you so much, Dr. Anne. I think on stigma is, like you say, we become the advocates in the spaces that we are, maybe family, friends. When you receive knowledge about it, just let's spread it across. And now, last but not least, there's a question that was just tailor-made to psychiatrists, and I would want Daktari to answer, and then we'll have a parting shot from Martha. So there was a specific question that was asked to a psychiatrist. I don't remember who asked the question. I think it was you, sir. Oh, yes, it was a question at the far end.
Yes. The statement he used, we don't like using, that we are all mad. I think many people joke about madness. We prefer to call it mental illness, but the question is, are we all mentally ill? We are all predisposed to mental illnesses. We are all predisposed to mental health problems. And remember, in my definition, I said, if you are able to adjust to stressors, because life will always be full of ups and downs. So if you are able to adjust to a stressor better than another person, so the person who is not resilient enough will develop a mental health problem or a mental health illness. There is also the genetic predisposition. You could face the same challenge, but one person breaks down, the other one is resilient. It also depends on the life skills you acquired as you grew up. Did you learn skills to navigate life? And also, these days, we are seeing a lot of hidden childhood trauma.
Yes.
Where probably you, as you grow up, you discover you are reacting to things which are out of the ordinary, because there are some childhood traumas which are not healed. So all of us are predisposed to mental health problems, mental illnesses, and that's why we need to remove the stigma.
Yes. Thank you so much, Dr. Catherine. Is the lady at the end? Did we answer your question? No? Let's not leave here with heart. Let me come to you so that you can rephrase the question. It's the last question.
So my question is about someone who was diagnosed with schizophrenia. They refused medication. They refused to accept the condition. And at the moment, they're not able to work, they're withdrawing. So the question is, how can this person be assisted? And is there a hope, like, can this person be able to live a normal life per se, or what can be done so that at least maybe they can work?
So, to answer your question, if somebody does not understand they are sick, then the next of kin can request for treatment on behalf of this person, and the law allows that. The other option would be the police have a role in the society to take someone who is sick to the hospital if this person has no family. So it is not lost. Depending on how you are related to the person, you could find the next of kin of the person to take them to a hospital for treatment, or you could, if you have no relatives, then you could go to the police station or to the chief to help the person be brought for treatment.
Okay, thank you. Thank you, Dr. Martha. You can weigh in on the same and then give us a parting shot from a psychologist's point of view.
Okay, thank you so much for that question. So again, as Dr. said, I think it also goes back to the individual who is suffering. How intentional are they? Again, how is the support system? Are they willing to walk with this person, this journey? Because again, for them to have been diagnosed means that they went through the process. That is having it screened, having it analyzed, and then to the point of diagnosing. So if the patient is still yet to accept, because again, this is a loss of a mental health condition. So this is an individual who just needs to be taken through slowly up to a point whereby they are going to come to acceptance. Remember again, they are still denying, they are still at a point whereby they are not able, they are still debating. Is it for real? Is it happening? So the people who are very close, the support system, they need to work with this patient. And again, I think yesterday I said, don't force them. It's a matter of respecting their boundaries, because this is a person who is going through that. How are you able to help this individual? The moment you are able to know this is it, like now we are giving you more awareness on mental health. Are you able to know the characteristics or even the signs and symptoms of that condition? So the moment you know this is how they behave, this is how they are feeling, this is how they are thinking, then now you can be able to handle it. But even as you do that, create a rapport. It's not like you're pushing yourself to this person. Are you able to understand what they are going through? And as you do that, you're going to be able to help this person.